Hello and welcome to the Pre-Chiro podcast. I'm your host, Dr. Ben Glass, and today we're making a professional chiropractor connection out in Chicago with Dr. Christopher Calarco. Dr. Christopher, can you get us started by just introducing yourself and also reflecting on that moment in life where you decided you wanted to become a chiropractor? Where were you at? What really pulled you in this direction to embark on this path?
Right. So my name is Dr. Christopher Calarco. I graduated in 2010 from National University of Health Sciences. And the first time I wanted to be a chiropractor, I think, was when I was really focused on, career paths in school, pre-med. We've all been through it. Actually thought about being an attorney, shadowed some attorneys, and realized like what you see on TV is not, the day-to-day lifestyle that the average attorney leads. So I shadowed a trial attorney. A lot of phone conversations, lots of reading. Not that I don't enjoy those things, but I really wanted to help people. I love working with my hands, and I love just the physical aspect of everything that really goes back to chiropractic, and especially, the whole body and wellness approach that we take. So that was the beginning of my path to say, hey, you know what? Let's jump into these pre-med classes. Let's switch up from the law major and get into the pre-med, and then obviously jump into chiro school.
Can you kind of reflect back on that time of life? Like, were you in college? Were you in high school when you first heard about chiropractic? Like, what was your orientation to it? Because obviously we come into familiarization with chiropractic from so many different paths. And maybe speak a little bit about maybe your upbringing or your background and how you brought that into chiropractic school with you as you decided to become a chiropractor.
Right. So I have an uncle who actually graduated from National, probably about 10 years before I decided to go there. That was actually my first introduction. I was big into sports. My dad does manual labor. I've been doing construction with him all my life. And I really liked the blend, again, of like the physical nature of helping people, with your hands, with those modalities. And then obviously the intellectual pursuit of how to do it, when to do it, who to do it on, what the pathology looks like and everything else. So for me, I didn't have a specific chiropractor that treated me as a kid. I was never really introduced to it. Like I said, I did have an uncle who went into the profession. And I remember being in high school, actually, maybe in ninth grade, and going to Chicago and visiting him and checking out the school and just thinking that it was just a really fascinating thing. I met a bunch of very interesting people who were extremely passionate, about helping others and about like really, educating themselves on everything to do with the body, and how they can help those people on a day-to-day. So, to be fair, I think it was him. I think it was my uncle who was like a big inspiration on me. I was the first person in my immediate family who had graduated from college. So it was a big step, and it was a direction that I knew I wanted to take. And I'll forever be grateful, for going to the campus and meeting the quality people that we did. And just getting a really good look at the behind the scenes of what those students deal with on a day-to-day.
Yeah, and if you could just reflect on your time in chiropractic school, what were some maybe surprises you encountered, some challenges you had to overcome? Like, what was your experience like? What paths of sort of focus did you decide to put your efforts on? And what was the overarching experience like in chiropractic school for you?
So I want to say that it was absolutely positive, but at the same time, like we all know that it's brutal. I remember being there, loving the students, really loving the material, especially pathology, neurology, and some other things, obviously adjusting labs, but being frustrated, about not being able to work during that time, the financial, burden that you get put on. I don't know how many students out there have to take out student loans, but I was one of those students, and just the overall just immersion of everything. My schedule was pretty well regimed. I had a certain amount of time to study for this subject and, another 2-hour block to study for this. I was kind of, and I'm not advising this at all, but I was kind of a student that cut class a lot, but I would actually go on my own, depending on the instructor, and really study. And I don't know how it is now because I graduated in 2010, but I would block out specific times because I was living in the city and I would have to commute to the suburbs to actually go to school at National. So I would block off certain times where I would focus on these specific topics, and really just mingled with a couple key people in the school who, I resonated with, that we could bounce ideas off each other. There are obviously some great memories that I have from school, between the instructors to just being, introduced to so much new material, to new people. We used to study a lot of times with a lot of the DOs who went to Midwestern, which was a lot of fun. And, it was an exciting time, frustrating time, obviously, for many reasons. And I know if you're a student right now, you're looking towards, the light at the end of the tunnel, that last day which you can graduate. But I will say, you should definitely, as much as you can, enjoy the process, because I made a lot of great friendships, a lot of great connections, that I'll have for the rest of my life in Chiro school. And, you take those lessons of discipline, of knowledge, of scheduling, of everything, and you can really bring it to your everyday life. So I think, like most people, I had a mixed experience of, those quality relationships and good experiences, but also the frustration from a time perspective, a lack of sleep perspective, financial perspective, etc. When I was in later tries, I was able to actually work with a clinic in Lakeview, which is in Chicago, in the city. And that was fantastic, because it would be great to go to school, do what we have to do, and then get into the real world clinic. I was an assistant there, get into the real world day to day and try to implement those things. And, it was eye opening, because you think as a student, you know a lot, and you do, but you don't know what you don't know yet. And then when you're actually seeing everything on the day to day in practice, you realize that some of the stuff you're focused on maybe isn't as important as this whole other area of material that can really make or break any business, but especially any doctor, as you get out there into practice.
And I think that's really a great segue. One of the things you just mentioned, which I think is really worth keying in on, is that you would spend time that you would otherwise would just be in class in a lecture hall listening to somebody maybe regurgitate some PowerPoint slides that you could just read on your own, or maybe just have an interesting conversation, but you actually carved out time in your schedule to design it to serve your needs and serve your interests. So I'm just curious, like, if you could break down with some level of specificity, like how you recommend people doing independent study, maybe for a specialized pathway. Maybe you can also use this as an opportunity to talk about your specialized pathway that you chose to take. Maybe it was at the end of school, during school, or in practice, but if you could kind of just get into that now.
Yeah, I think everybody's pathway, especially in school, just depends on their personality type and what they like. Some people are going to really, soak up everything that instructor says, and it depends on the instructor, it depends on the student, but everybody's got different learning styles. There was some that I could sit, not take any notes, take it all in and feel fantastic about. There was others, just it has nothing to do with the specific instructor, the lecture, the material. It just was, we didn't resonate as much on, how I would learn. So I would make sure to carve out that time, because at the end of the day, you just need to know the material, you need to pass the exams, and you need to obviously have it for your profession going forward. So I looked at it as, you need to maximize your time. There's only so many hours in the day, especially as a student. So it's like, where can I pull the most amount of material out of this time, and still, like, again, be able to sleep, be able to work on the side if you have to, and everything else. Because there's only literally, when you're taking that many credits as a student, you have such limited amount of time. There's no way getting out of the labs, right? You have to be in those labs on the day to day. So, for me, I think that worked best. But again, I think it depends on everybody's specific learning style while they're in school. I will say that I would recommend that everybody get some form. And I know a lot of doctors do externships and stuff, but I would suggest that you get some form of, external training. And it doesn't have to be extremely, time consuming. It can be 1 hour a week, 2 hours a week. I think I worked in that clinic 3 to 4 days a week, again, whenever I could during those hours, just because, again, it gives you different insight into personality types, patient bases. I'd be talking to a lot of different patients, hearing about their pathology, hearing about the day-to-day, picking up exactly what that experienced physician was talking about, looking over x-rays with them. And I think a lot of doctors out there would really love to mentor, a young doc, or a doc who's a student who's going to become a doc who's still in school, obviously, and, show them. I think people go into a profession because they're excited about what they do. And I think that those mentorships opportunity, I think they're often overlooked by students. And I do think it's because, not all of them, because I know some who have done a lot of work in that arena, but I do think it's just because of the time constraints and the overall stresses. But I think it was highly valuable for a lot of the students that I saw who got out and, again, actually got that real world experience. Because just to go back to it, you don't know what you don't know. And all these soft skills, even how, somebody presents day 1, day 2, day 3, what it looks like when you make a referral out to a specialist, how to take these specific images, for this patient that's outside a clinic, especially somebody who maybe can't get in the proper positions that you would normally be like textbook when you're taking imaging, et cetera. So that's what I would recommend for any student out there, or even a younger doc who wants to get better at their skill set, to go out, and even if it's just a day, again, shadow, can stay on the CE credits and just continually educate yourself on material, because you never know what's going to click. To answer your question a little more in more detail, for me, I did my rotations through Salvation Army, which was like 9th and 10th trimester, if I believe, which was downtown Chicago. It was a very indigent community, and we'd show up in the morning, pretty rough area in Chicago, and there would just be a line of patients literally out the door from the Salvation Army around the corner, and it was our job to do intake. So you do exams on everybody. Again, you'd have that personal interaction, see what's going on with them, try to line up the top 1 to 5 priorities that you need to look for in that patient. Do we need to send them to the ER, or is this something that we can handle today in the clinic? And you just go through and start to build those connections, the interactions. And I think you build your confidence too in those scenarios, because as much as intellectually, I know, and I still do this, and I'm sure you do too, Doc, we have a tendency to over-explain and over-talk to patients sometimes, and some may want extreme detail, but some just want like the talking points. They want to know what to do, when to do it, and that's it. So you'll learn a lot of those soft skills that I think can often be overlooked in school.
Yeah, and I think that, so this conversation, the parallel to it is this pre-chiropractic program that I'm providing as like a structure to the conversation. So we just kind of talked about the foundation of why you decided to become a chiropractor and what your experience was like personally. But I'm wondering also if we could transition now to you talking about these skills that you've developed over the course of the last 15, 20 years now, of what being the type of chiropractor that you've become has required you to develop skill set wise. Maybe you could break it down at a granular level of all the different types of skills that you're expressing as a chiropractor in the real world these days.
Yeah, that's a great question. So I'm going to kind of break it down into 2 different things. Number 1 will be the actual treatment skill set, which I do think that's specific to each doc, right? And then I'm going to break it down into the business skill set, which I do think, you don't learn a lot about in school, and some people will do really, really well when they branch out and learn how to help more people, which is basically how to run a profitable business, right? So from the treatment side, I focused on a lot of rehabilitation, ART, Graston, I think like a lot of docs out there, diversified techniques. And I don't want to dive too much into that, just because I think, again, everybody's got their own specific niche. What I did learn early on, I was an associate, again, downtown. We were in a high rise. And to go to the second topic, one of the key things I learned about networking and business and stuff like that and growing a practice was I came into a clinic and there was not a huge patient base there. It was a high-rise building, and it had a lot of OB-GYNs for some reason, and a lot of actual psychologists and dentists. For some reason, this high-rise had a lot of these 3 things. So I learned to network, again, with other healthcare providers, and realized, for me at this time, being a newbie, not knowing anything, how important it can be to, get to know people, whether it's your building, your community, or anything else, which sounds like a no-brainer. But when you're doing it on a consistent basis and showing the value that you can bring to other healthcare providers, we started getting a lot of referrals back from the OB-GYNs, obviously for pregnant women who had lower back pain, which was a great patient base. We did a lot of flexion distraction and other techniques on those patients. And then, and there was also a lot of neurosurgeons in that building. There's actually 3 different neurosurgical groups. And we ended up getting tapped into by giving presentations, just the neurosurgeons who they're a lot, 90-something% of the patients they see, they don't need surgery, right? They're just there for consultations, for the surgeons to sign off on everything, get everything diagnosed, and then they're going to send it out for PT or chiro, which I think it should be chiro. I'm sure you do as well, in most of these scenarios. So we ended up linking up with them, and they would refer patients to the practice. And that was, for me, my first introduction into like really getting out into the community. I've never done a spinal screening or anything like that. I actually, because of where we were positioned, just happened to network with other healthcare providers. And that has always been, the number 1 actual area where we're getting referrals back from is other healthcare members of the community that we have tapped into, who we understand what they do. They understand what we do, and we work on a very, very respectful basis on cross referrals. And when you get quality feedback from a patient, whether you're referring it out or whether, they're going to another provider, it makes a massive difference for the number of new patients that you can get back. And we've seen it time and time again because, even primary care physicians was another big one that used to refer into the practice. They don't want to deal with like lower back pain and just anything really physical. They want to go in. If there's somebody who's with a cold or a flu, they want to do what they do. They want to stay in their lane. And that's fantastic because it opens up the door, to doctors like us who are able to go through and educate not only the patient base, but also other members of the healthcare community who are dying to utilize your services. And if I may, when I first was in school, I didn't know it was going to be like this. Like I thought that there was a negative connotation in some ways towards chiros. We did get a little bit of an introduction to it in the beginning because there was a DO school that, again, we would study with the students, and we were all basically studying the same thing up until like 6th or 7th trimester. And we came very close with them, but I had never really seen, in my opinion, or in my experience rather, a ton of collaboration between the different providers, and starting to be able to put that together to see that, and see that people are just people. Sometimes, at least for me in school, you'd put people up on a pedestal, be like, oh my God, like this amazing neurosurgeon's doing this. Over time, it just came to be that you have a quality person who respects you, you respect them, they like what you do, and ultimately you're getting the patient outcomes. And if you can do that, and then not take it for granted, which I've seen time and time again, when you start to build, those referral sources, you can really build a thriving practice.
Yeah, and just speaking from experience, documentation is so important, documenting those outcomes for patients. If you could maybe just describe what those relationships are like with other providers, how you start the relationship and how that relationship evolves, maybe how many touch points there are, or just what it's like to be a chiropractor, and how these other professionals, how you're teaching them and training them to think of you and look at you, and then also how you're communicating in a language that they're maybe familiar with through your documentation, or just through your professional expression, like who you are as a doc. Can you kind of just describe what that's like as a chiropractor?
Yeah, 100%. So I will say this, and I don't mean this in a bad way, but I do think sometimes people overcomplicate it. There's not some secret, there's not some hack. Like at the end of the day, you need to be confident in what you do. You need to continue to build your skills, get out there and build your confidence, and then you need to make those quality connections. And that's not hard. I'll be honest with you. When we actually teach a whole course called PI Expert Secrets, which is about getting in front of the medical community, getting in front of the legal community. And we talk about this all the time because, again, I think many doctors, and I don't know exactly what it is, but they overcomplicate it. You just need to do a search, Google search in your area for specific physicians that you're looking to network with. Maybe it's one spine orthopedic surgeon, one pain management physician, maybe a neurologist to deal with concussions, PTSD, head traumas, or anything else that you're going to see related to sports, auto accidents, work-related accidents, etc. You need to build your referral network. And again, you can just research who's in your area. If you haven't, this is obviously starting from scratch. Google who's in your area. You can see the type of digital footprint that they have. You can see the kind of reviews that they have. And then again, it's not complicated. You need to just call the provider and let them know who you are. Hi, my name is Dr. Calarco. I'm a chiropractor in the area. I'm looking to refer and work with an orthopedic surgeon. When does the doctor have time for me? When can I get into the office? And I've never had anybody say no to that approach. Many of the physicians who you're going to meet, a vast majority, 99%, are going to be really happy that you've taken the time to reach out, as long as you can provide quality services, right? If they're getting good feedback from the patients, they're going to be ecstatic, because these doctors are super busy too, and they want to network. Unless there's a big healthcare facility, like, obviously we're talking a hospital, or like a really large, like orthopedic group where there's a ton of bureaucracy, a ton of doctors in-house. If you can get to any of these smaller groups, which are a little bit easier to tap into just because it's a little bit more organized in some cases, and they have more skin in the game because it's not some gigantic corporation or some gigantic hospital where they're just on salary, they're going to want to meet with you. They want it. This is how they build their business too. And, I don't know how it was 20, 25 years ago with, every doctor kind of being siloed. It's not like that anymore. Like, you talk to any orthopedic surgeon, for the most part, any younger orthopedic surgeon, or any, again, a neurosurgeon, any kind of pain management doctor, they want to network with chiropractors. I do interview content with them nonstop, and that's what they're saying. And again, reach out, introduce yourself, set that meeting. When you get in front of that physician, don't talk their ear off, because again, that's a big, I think, mistake that chiropractors make. We get so excited about what we can do. Hey, we can, work on this pathology and, disc herniations and blah, 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 blah. Yes, you want to talk about your skill set, but first and foremost, you just want to get to know that doctor as a person. And if you can get into their office, bring them something, little treats for, the front desk, be polite, be cordial, build a rapport with everybody in the office, because they're going to be extremely important when sending new clients over. Have your script pad ready for your clinic. Meet the ortho, let's say in this case, as an example, you have 5 to 7 minutes maybe to sit down with them. You start the relationship, and I'm sure like 99% of them are going to be like, okay, this was great. We should go out to dinner one night or anything else. It was shocking to me the amount of other healthcare providers, and I don't care who they are, that wanted to network with chiros. Their chiros can be an amazing referral source to them, but they are also an amazing referral source for that doctor when they don't want to deal with like a big box physical therapy shop, where they don't want 30 or 40 patients in a room with 1 or 2 PTs, doing all these cookie cutter exercises. Our skill sets are perfectly positioned, with the musculoskeletal care and other things that a lot of chiros out there do to help each one of these physicians. And I hear it time and time again: neurosurgeon, pain management doc, orthopedic physician, primary care physicians, they'll all say the same thing. And a lot of them now, the vast majority of their business are referrals from chiropractors and vice versa. So as far as touch points and how often you should be doing this, if you want one of each specialty in your area, great. If you have the volume to kind of spread the love a little bit and be more diversified with different providers, great. You want to have, though, a nice, happy family that you are connecting with, again, initially, like we discussed, and then on a rotating basis. And you don't want to be a nuisance, but you want to just make sure you're touching base with them. You can set up CE events with them for attorneys to do, personal injury cases if you want. Maybe you can record some digital content with them, which they love to do. They love to talk about their profession, that you can present to your patients or for your digital platforms. And then, of course, the vast majority of the time, I don't think a lot of the doctors like doing gigantic events. I think they like just a one-on-one. So if you can grab a coffee, a dinner, or something, even if it's once a quarter, not to mention, the co-management back and forth, I think that that's crucial. And if you'll just allow me for 1 second just to talk about kind of like what the relationship looks like when you are, cross-referring for the communication. So you've set it up. Let's say you have your specialist that you're working with and vice versa. It's not complicated. Anytime that something is needed, so there's 2 different ways these patients can originate. If it's your referral that you sent to them, they should just be seeing it for their consultation and then sending it right back to you, rather, to manage everything. So if there's an MRI needed, EMG, NCV, whatever's needed, specific therapeutic exercises, whatever's needed, you're going to be the quarterback on that case. And then vice versa, you're going to learn when, let's say, that patient originates, let's say with an orthopedic spine surgeon, they send it to you for therapy. You're just going to follow their scripts. If you think something is going on that is new, or maybe it's missed, or maybe you think the patient needs an MRI or any other diagnostic tests, or maybe something's just a little bit odd there, you're going to contact them and let them know, hey, you know what, here's what I think about this. And again, 99% of the docs out there will correspond either via text or email. You don't want to be writing, HIPAA information via text, so keep that short and sweet. Jump on a phone call and just have that conversation about what's going on with that patient. And they will do the same thing to you. I think most of the savvy doctors now, specialists, have learned that they need chiropractors. They want to work with chiropractors, and they will go ahead and send you specific information based upon the patient, whether you're sending it to them or whether they're sending it to you. So I think that's the most important thing. There are some caveats for certain specific providers where they might want imaging before you send it over for a referral or everything else, but you can work that out as you guys kind of get to know each other. And that relationship, can be a massive amount of volume that's being sent to your practice. And it's really the best kind of volume, right? Because I think as solo providers, sometimes, you can feel lonely. It's like, it can be lonely to run your own clinic and not really collaborate. It's not like you're in a hospital environment with all your other coworkers. Depending on the size of your clinic, you may have an associate, you may not. So to have those other healthcare providers that love to actually talk pathology and who are open to phone conversations, both on the treatment side and then obviously on the business side, can be really helpful.
Yeah, no, thank you for that. I really appreciate you going deep. And you mentioned PI, expert secrets. I would love for you to touch on that in a moment. But also, what does PI stand for? And if you could talk about the different presentations that your office sees on a daily basis, kind of like the day in the life of a chiropractor, if you could kind of just reflect on what that experience is like to provide care, but also through the person that you're taking care of's eyes. What is it like to come to your office, your clinic, and be seen, and just continue to build context for that prospective student or that current student that's not familiar with the type of practice model that you've developed?
Right. So PI stands for personal injury. And that's going to be people who were involved in slip and falls, but it's mainly car accidents. So our practice specializes in work-related accidents, car accidents, sports injuries, obviously, treatment for family, etc. We don't see pediatrics. And from the patient's perspective, when they come to the clinic, they know from the minute that we schedule them that we work with a large healthcare team, that we are dialed in and we really understand this specific, injury that they're related to, especially related to work and auto accidents. So what happened was, is because we specialize in this, I ended up having a really good friend of mine who's a chiropractor who owns a media company, who for years was badgering me, like, you got to teach this, you got to teach this. And I'm like, listen, it's just treatment. It's just treatment. He's like, no, it's not just treatment. It's a specific niche of treatment. And it's not the treatment so much. Yes, you have to know the pathology from whiplash and all these other accident injuries that you commonly see, but it's how to navigate the healthcare system, how to build a network with how to build a network of providers, how to speak to attorneys, which can be a fantastic referral source for you if you really understand the documentation, the communication, and how a personal injury case works. So after, after probably, I don't know, a year and a half, 2 years of him, just saying, you got to do this, you got to do this. I was like, you know what? That's great. I love to help. Like, I have a little bit of time now. Let's start putting it together. So it took another probably about 3 years to develop this membership / course that we have, where we teach doctors specifically how to network with attorneys and just how to do everything from A to Z when it comes to the treatment, documentation, marketing, and organization for personal injury patients specifically. So that's become a huge, it's exciting to teach new doctors these things, because it's fun to show them like what PI looks like, what the niche is, but then really like how to take those lessons and then transition it into the rest of the practice. So yes, if you network with an attorney, are you going to get, patients that come who are in auto accidents? Yeah, of course. If you're doing the right things, you know what to say, and you provide that quality care and they get good feedback. But then you get to dive into those specific pathology that you see on a day-to-day, which with car accidents could be anything. There's, some people go to the hospital, some don't. You got to be on your toes, like with any patient base. You want to make sure that you miss nothing, and everything needs to be in that documentation if you really want to do right by that patient and by their attorney representation, if they have any. And then the lessons you learn with networking in the community, especially with the medical community, really parlays into everything that we were talking about before, about healthcare teams and really building up the strongest possible treatment profile for that patient, the strongest possible treatment group. And then if you relate it to the business side, if you're doing PI case injuries with a certain, let's say, again, pain management doctor, they're going to utilize you for the rest of their stuff too. So if you can patch together, again, a couple of those specialist providers and they're referring over 5, 10, 15 a week, like, you can see how that can really add up, whether it's PI or any other, patient that's injured on a day-to-day.
No, absolutely. So, yeah, that question that I just asked you was related to the third stage, which is the apprentice model of just gaining an insight into the different types of practices that exist out there, the different clinical models, the different business models, and the different ways that chiropractors practice. This fourth stage is them starting their own pre-chiro club on their college campus. I'm wondering what approach you would take if you had maybe a student that you were mentoring and they were wanting to start developing and establishing a presence on their college campus just to get real world experience and gain skills of like marketing and communicating value and attracting people to their club just as they would attract people to their practice in the future. So I'm just wondering if you can get creative with me here and think through how you would instruct a student to theoretically establish a pre-chiro club and then grow a pre-chiro club to maybe scale it.
Okay, just so I have the question correct. So I'm a student, I'm on a campus, I want to create a club for doctors so that they can learn skill sets, correct?
No, create a club for other students that you could
I'm
attract
sorry.
other students
That's
to
what I
your
meant. I
club.
apologize. Yes, right.
And
So other Cairo
maybe
students.
you're
to the
working
club.
with doctors, maybe you're working with faculty, maybe you're working with administrators, maybe you're just working on your own and developing your own content. But yes, your goal is to connect with other students in the community and establish a presence of chiropractic and maybe share the different knowledge that you've been given with other people.
Got it. Sorry about that. I meant Cairo students. I think I just said docs about that. So I apologize. That was a great explanation. So if I'm a student, I mean, you're going to want to do anything you can to bring value, right? And you just summed it up perfectly. And I think it's the perfect time to do that. You're a student. You may not have a lot of time, but you have more time maybe than if you're a doc out there with a family or anything else. And what I would do is I would look at each and every skill set that could be helpful to you as you get out, right? So you're going to break it down. Part of it's going to be business. You don't really learn a lot of business in school. So how could you get that business acumen, let's say? I don't know whether that's online content that you could be learning. Maybe you can set up something with some doctors who do really well, who would love to give back and either do a presentation online to, again, this group, this pre-chiro group, or meet in person. You could probably set something up in their clinic that they would love to walk you through. There are so many training modules that they have for day ones, day twos, walking you through specifically what patient care plans look like. Because again, I think that's something that, at least for us, when I was in school, we got some of it, of course, but I think it was an area of weakness. I would also really go out to the community too. And just like if you were a doctor, I would network with orthos, pain management docs, other physicians. And I cannot see any quality human being, who's basically approached by a chiro student saying, look, we would love to just like listen to you speak for a half hour, do a Zoom call with you, or even come into the clinic. Like every physician out there, I mean, vast majority of them want to help people. And it's exciting, I think, for them to, again, showcase what they do and really give back to younger docs. And I don't care like what the actual specific healthcare space is. So I'd be reaching out to every single specialist in the area that I think is worthwhile. And I would offer them, again, either in person, a Zoom, or some kind of presentation. And I have a really good feeling that they would go above and beyond to do stuff on a consistent basis, whether that's shadowing for procedures, whether that's like a day in the life, whether that's, again, specific topics that you can answer over, Zoom or any other video format. The business aspect, obviously, I would focus on, like we discussed before. And then I would make sure that I work with somebody who really has good adjusting skills. And I know we get a lot of this in school, but I don't know if you ever get enough. I think as much as you adjust in school and as much as you're ready, I think the more people that can introduce you to different styles, different techniques, different modalities, whether on the treatment side, the adjustment side, or anything else, could be extremely helpful. But if I had to focus on two, I definitely would focus on the practice management, because I think it's the weakest area in schools, and on the networking with other healthcare providers, because that's huge. And I also think it opens up something inside you. Again, I had a preconceived notion for whatever reason. I don't know if this was taught really in school, that we were kind of siloed as chiros, not really work with other healthcare providers. But in the real world and in my experience, to have that experience while I was in school, I think would have allowed me to hit the fast forward button even sooner, and actually grow my patient base sooner and get to know just a lot of quality human beings sooner. And give you different outlooks and insights into what healthcare is. And it's multiple providers coming together to help the patient get better.
Yeah, and I think with that same spirit and that same energy, the message that you just shared, if we could transition to this stage 5 independent study, I'm tasking you to create a prompt, a creative project that students can work on for maybe 3 to 6 months, an idea that's maybe original from you, but maybe they get to focus and study and explore a specific topic of interest. or maybe you can kind of give them an idea of, if you had 3 to 6 months to go off and explore and do an independent study project, maybe something that you would consider doing.
So if I was in school, I would want to do an independent study project. I think sometimes you think you know what you want and you actually don't until you do it, right? So I think sometimes, at least for me, I was like, I'm going to do a ton of rehab, or I'm going to do a ton of this technique or a ton of that technique. But you have a very like tunnel vision on certain things, I think, because you're so busy, because you have exams, because you have so much going on as a student, financial stressors and everything else, that I would really take the time to shadow as many people as possible with all different techniques, because not only are you going to learn a bunch of different personality types, you're going to learn a bunch of different technique types. And if you spent 3 to 6 months, and I mean even just once a week, shadowing different doctors in the community, not only would you open up your eyes to new things on the business side, on the profession side, on the diagnostic side, but you'd also be networking. So if you were going to stay in the area, or even if you weren't, you'd be meeting other quality professionals, and you'd be surprised again how many docs, how many chiros want to help younger chiros. So if you're doing that for 3 to 6 months, and let's say you got 12 of these different doctor clinics that you've lined up, you've learned all these techniques, you've done these things, but then you've also built the connections. Maybe you move to a different state when you graduate. You want to move back home or somewhere else. I wouldn't be surprised if one of those 12 doctors, knows somebody in that state if you want to be an associate, or maybe knows somebody in that state who can help you, get your practice off the ground, or somebody that you can collaborate with, in that specific area. So, it's a small world, and you'd be surprised. I don't care if you're in the largest city, how many people, again, know each other, especially now with digital media and all the online social media platforms. There are a lot of connections that can be made if you take the time to really just keep your mind open. Don't be afraid if you make mistakes, because I think that was an issue that I had. I never wanted to say the wrong thing, whether it's an instructor asking me a question or whether it was in any other area. And I think that guardedness kind of held me back from maybe expanding certain topics further. So I think I just wouldn't have as much of an ego, and I think I would just be open to just asking as many questions as possible, being vulnerable and trusting, that those people around you and the network that you've developed are really, really going to help you grow. And it's funny because you never know who's going to be the person that maybe, introduces you to that next physician who's going to get you a job or anything else. And I'm sure you've seen it, Doc, but we've seen it time and time again. I'll meet somebody at some event or something. It's a paralegal who just happens to have a great conversation. I have no idea who this person is. And then sure enough, they work for one of the biggest law firms in this specific city, that we're in. And we start getting business and volume from that just because, you built a quality connection. And then I think that's really what it comes down to. I think if you can maximize your quality connections over time, just for the point of doing that, you'll actually, in a weird way, be setting yourself up in a really good way for business.
I'm curious, Doc, as we segue to the end of this conversation, what is inspiring you? Where is your focus and passion at these days? Where are you investing time and energy and effort in, professionally speaking?
Yeah, for me, it goes back to the personal injury. We're really growing our network of providers. We're growing the medical professionals that we work with. I'm really inspired right now. As much as I hate doing it, I hate doing video content. I'm not, but I do it every single day. And I work with a lot of other healthcare professionals to do it because I think it's important to get the message out. And I think you have to, like, the writing's on the wall, right? Like social media and all these things are where it's at. And I'm actually inspired to do a lot of these videos that we do for educational purposes, for attorneys, for patients, for everything else, because it helps us keep a contact with a lot of these other specialist providers that refer stuff over. And then on the flip side, the course that we developed, for chiropractors who want to be experts at personal injury and grow their practice, a lot of my time, energy is really focused on that. Again, just trying to put together every single day the most amount of volume of quality content, with interview content from paralegals to attorneys to surgeons, to anybody else that's in the field related to personal injury, so that doctors can, again, take those lessons, maximize PI in their practice, but really just maximize their practice in general. And, I love teaching, and it's something that I wake up every single day and I'm excited about. And I love the strategy sessions that I get to do with doctors all over the country because, again, you just meet some really cool people who are doing fascinating things. and to even share, 5 or 10 minutes talking about them, how they can do better. And then you always learn something in the process too, it's inspiring and it's amazing, especially again, when you don't, work in some large scale facility with a lot of different practice members. So.
And then as we wrap up here, if you could maybe just kind of speak to that high school or college student and help them align with the path that makes most sense to them by maybe from your perspective differentiating these different healthcare professions and maybe differentiating chiropractic just so that they can understand the uniqueness and opportunity in this direction if they decide.
Right. And again, I think it comes back to real world. I think there's, theoretical, like, book smarts and other things. And then I think there's the real world, right? And there's a blend of the two. And I think you need to go out, and if you have an inkling to be in the healthcare space, you need to shadow every single like type of different healthcare provider, which again, they'd love to have you. So you get an idea on what the day-to-day looks like. Because again, we have these ideas of what it's supposed to look like, but it's different when you're in the nitty gritty. Everything's got, positives and negatives, or, struggles and quality things that happen on a day to day. And I would do that. I would focus in on making the time to shadow these different physicians, see what I liked, what I don't like. And then think about, are you someone who, wants to do exams and just write scripts for medications and other things, and obviously diagnose, et cetera? Are you somebody who likes to use your hands a little bit more? And then maybe you want to go more into the DO or the chiropractic path? Are you someone who believes in, holistic medicine and really, really loves helping your patients on a day-to-day, with those manual techniques? And I mean, the popularity of chiropractors, I feel like, has never been higher between, all the different social media videos and everybody addicted to the adjustment videos and everything else. And I mean, just because of the sound of it, they know the patients are feeling better, right? And I think it's a phenomenal time to go into the profession if you're passionate about it. So I do think that that's the main thing. You need to see what resonates with you, what really kind of lights that spark in you, what you're passionate about, because I think that if you want to be in the healthcare space is what's really going to drive you to excel, especially when times get hard, and they will, for all of us. And school can definitely be like this roller coaster of emotions, especially leading up to finals and everything else. So you need to be in it for the long haul. And that means you need to be really, really passionate about what you're doing.
Thank you so much for sharing with the students today. I really appreciate it. And if they want to connect with you, I'm sure we'll be able to post some links to connect with you at a later time. I'm just curious, not to get political here, but because you went to National and I went to a school like Life West, and I transferred from a school like Western State, so I'm familiar with how different the experiences of the students at the different chiropractic schools can be. And I'm not necessarily talking about which school is better, and I'm not talking about which camp is better or worse or any of that stuff. I'm more just curious for you, the chiropractic profession as a whole, what do you think we can do moving forward as a profession to maybe collaborate more, as you're talking about with different professions that you're able to collaborate? And what can we maybe do to build a stronger profession as a whole? I'm just curious if you could maybe riff with me on that for a few moments.
Yeah, no, I'm so glad you actually brought that up, because I remember feeling that way in school where there was kind of different camps. But to be frank, I go to seminars all the time. I'm in Parker every year for Vegas. Like, I don't necessarily see that in the profession as much, like, especially when I'm talking to doctors. Yeah, there are some divisions and stuff, like I'm sure like any profession. But my advice would be just become a practitioner at what you do, and the bread and butter of what we do is obviously adjustments, right? And if you can get that skill set down, you are focused on that. And then, like for anything else, when to utilize the expertise of other providers. And I used to have, just to speak to this really quick, an idea that the surgeon's only going to want to do surgery, et cetera. A lot of the people that I meet are very, very, very conservative, on the specialist side. They don't want to do that. They want to do that as a last resort. Drugs is a last resort. And you have to meet the healthcare providers out there that, again, I keep bringing it up, that resonate with how you feel and how you practice. And there's a ton of them out there. And then you just need to be honest with yourself and honest with them about what you're looking for. And I do think the number one thing that chiropractors could do right now is just become experts at their craft. And at the same time, like, not be so shut off to the skill sets of other providers, and have those the dialogue, especially about patient care. And I know we're wrapping up, but I've seen time and time again instead of just like writing off somebody who's recommending something, who's another healthcare provider, if I've seen the chiropractor reach out and have conversation, that sparked something in the pain management doc that was like, hey, you know what? Maybe we shouldn't do these injections this time. Let's focus on this. So instead of writing somebody else off, I just think you do need to come at them with love, with empathy, and just try to like educate them on specifically what's going on without preaching to them, because they're professionals as well. And I do think once you build that rapport rather, between providers, it goes a long way to help you, to help your business, but also to help the profession. Again, I can't tell you how many specialists that refer to chiropractors now, which I don't know if that was necessarily the case. I wasn't around in the profession 20, 25 years ago, but I do feel like it's changed from what I've heard from a lot of the older doctors. And that's just because chiros have taken the time to educate and to have quality conversations, with other healthcare providers.
Mm-hmm. I'm just curious. Sorry, I keep
no, I'm good
in the conversation.
Yeah.
What are some of the favorite trainings that you did, maybe to unpack the sciences or the philosophy or the techniques or the modalities? I know that you said every practitioner is unique and different, but I'm just curious, like from your vantage point, like what are the journals you're reading, or where are the resources at that you find to have the highest value for the things that you're interested in?
Yeah, that's a really good question. So initially, obviously I took ART, sports medicine was my thing, focused big on sports, different modalities there. But truthfully, I think for right now, the biggest learning experiences that I go to seminars. Again, I love Parker. I love a lot of the other seminars. I do think you need to be doing anything, no matter what it is, consistently, because you don't want to become stagnant, because things change fast, especially in healthcare. But for me personally, actually, the biggest learning lessons have been from seminars, but then also the conversations that I have. Like I'll speak to the chiropractic radiologist, who's a good friend of mine, once every 2 weeks, and we're going over spinal pathology and everything else. He's been in practice forever and he's a whiz. And I am always picking up little tidbits of insight from him. So I think it goes back to the connections. Same thing from the neurosurgeons to the orthopedic docs and everything else. I have a question, we're on the phone and we're talking about the pathology and like where their specific expertise comes in, what they're looking at, how they feel about it. And not that differs from ours at all, but how basically are there little nuances that you can pick up, that their education taught them that maybe we didn't get, and vice versa. So for me, it's to be frank, the past probably 5 to 7 years has just been a lot of networking and personal interaction would be number one for me. And then number two would be a lot of the CEs that I've taken related to chiropractic, which I think, again, is fantastic.
Yeah, for sure. I just was curious if there was any specific CEs that really stick out to you in your mind of being like, wow, that content and substance in this CE course or in this particular person's program, not to like endorse anybody, right, but more just to shine a light on the different quality pieces that are, light posts that are out there in the profession.
Yeah, I mean, I'll be honest. So I've taken Croft's material, which I think was fantastic. I don't know if he's no longer teaching that. It's extremely in-depth, but that was my first actual introduction. I've taken some chiropractic orthopedic coursework, which I think was really, really great. They have fantastic seminars. But this is going to sound funny, but Squat University on YouTube, I know for all the young docs out there, it's fantastic. The guy's got great content. And I do think more and more and more, you got to be very careful who you follow. But even for a simple thing that you don't have to pay money for and it's not a CE, a lot of these platforms online, especially YouTube, can be extremely helpful. And the first one that comes to mind is Squat University.
All right. Thank you so much for just being vulnerable and sharing insights today, and really appreciate you taking the time. So thank you.
Cheers. I really enjoyed it, Doc. Thank you so much.
Mm-hmm.